Thank you. Thank you, Chair. The CCG-UHL paper is a joint paper, but does not set out clearly the position of the CCGs. UHL went to 2 scrutiny committees in 2015, but it appears that the CCGs did not. UHL believes that the response of the 2 scrutiny committees legitimised their wish to avoid public consultation, but the CCGs do not offer any explanation as to why, back then or since, it would appear that they did not fulfil their legal duties to involve the public through consultation. These legal duties cannot be waived or delegated, and the duty to consult a HOSC is not an alternative to involving the public through consultation, but in addition to it. But UHL's position is also difficult, not only because it omitted Rutland back in 2015, but because it went to the wrong committees. It should have taken the relocation of Level 3 ICU to a mandatory joint scrutiny committee. It alone has the legitimacy to comment on a matter which affects people across more than one local authority area, but the joint committee was never consulted. So it seems to me that the claim that a decision was made to relocate ICU without public consultation cannot be justified on the grounds that it was made in the full knowledge of the wrong 2 scrutiny committees. So the decision, which the paper says was made in 2015 and reaffirmed since, has a problematic status. It seems it was made by CCGs without fulfilling their legal duties, and so arguably is invalid. I suspect a judicial review looms in everybody's minds. The decision is also problematic because it seems to have been made essentially on clinical grounds. Now, obviously, clinical grounds are very important, and UHL can argue a good clinical case, and I think we will hear a lot today about UHL's passionate commitment to patient care and saving lives. But the matter is not purely a clinical issue. It has implications for the future of the General and for the wider network of health services and the way in which patients and public engage with those services. Regardless of the fact that some services are left in place at the General, it is stretching credulity to insist that the removal of a core service does not have some impact on the likely future of the General, in a context where we know the long-standing goal of the NHS leaders locally is to close it as an acute hospital. We are told that we can have engagement on those issues, but engagement falls a long way short of consultation. We are told we cannot have consultation on those issues until there is surety of money. We first expected a consultation on acute reconfiguration in November 2015 under Better Care Together, but it has been repeatedly postponed since, and it might be years before it takes place. So a future consultation does not offer a reason for not consulting now. Instead, this ever-retreating future consultation points precisely to the wisdom of having a consultation now. The removal of Level 3 ICU from the General actually offers the perfect opportunity to enable the public to express their anxieties and concerns about how decisions today affect the services of tomorrow. The CCG should engage systematically with people's anxieties, views, and yes, knowledge. Some of the public are knowledgeable. Instead, the message seems to be that the public have nothing of interest or relevance to say on this matter. I'm sure the CCGs do not intend to send this message, but it is a message which some people feel they are receiving.
About 30 seconds left.
The consultation will cost money, but it would have cost money anyway. There will be a financial hit, but that is because local decisions did not fulfil their legal duties to make sound decisions. There will be an impact on the Children's Heart Centre, but I'm sure that the very capable management of UHL will manage that by the deadline concerned. There is a reference, or has been in the past, to the possibility of losing the £30 million of public money, but that would be an interesting development, since presumably NHS England and NHS Improvement have to ensure that all the legal requirements have been fulfilled before they sign off the project. Did they do that properly?
So
I don't
can I
know.
ask you to make your closing comments, Sally? Thank you.
I have not discussed this with them, but I believe our elected representatives inside and outside the room would be happy to make strong representations to NHS England on the importance of retaining funds. The fact that a decision was made in 2015 or afterwards does not invalidate a public consultation at this stage because, as I have said, the decision appears to have been made in a way that does not have a solid legal footing. The best thing now is to regularise the situation by reversing the decisions pending formal public consultation. This can be done by submitting papers to that effect to the governing bodies of local NHS institutions. Then the public can finally express their views, ask their questions, see the equality impact assessments and so forth, and contribute to the future of their health services as indicated in the NHS Constitution. This is an opportunity to apologise, to regularise and to restore community trust.
Right, thank you, Sally.